Spirituality is private. It's personal. It's about your own personal intimacy with God.
We wanted a revolution. I will tell you today, without spirituality, it would not be a revolution.
We really are, we're really very holistic in our approach. Clinically, therapeutically, spiritually, for the best quality of life.
We can learn things, we can make things, but you really can't take care of the patient with just pills and programs. It really requires a soul. It requires that last support of spirituality to bring the care to where it needs to be to make our patients whole.
It's a seamless partnership that they're with us every day. It's not I need to have the chaplain come in, because we're going through a difficult time, and you hear the word difficult time and people think of something bad, and it's not that. It's a change in the daily activities of that patient every day. It's a change in where they live, and so there, it's at times like that faith lessons sometimes, and your strength as a person lessens, and they are really the person that helped that resident maintain that.
I was doing an acquisition back in March for some of our new buildings, and I was talking about benefits and policies and all this stuff, and then I started mentioning spirituality as a pillar, and it actually got a standing ovation.
Yeah, it's so unique. In developing the three pillars, some were investment, some were driven with talent, some were new way of thinking. But spirituality was actually the most challenging one. To bring God in the workplace today, especially in the U.S., was a challenge from a legal and HR standpoint. People told us for a year and a half we couldn't do it. After research, we believe bringing God in the workplace was the single biggest event we made in our company that transformed the revolution to reality.
Well, when Joe and Diane first approached me about creating a Department of Spirituality, I had the first thoughts that you'd expect of a lawyer, which is, what risks is this going to pose to the organization? And the more I thought about it, and the more I researched and realized that most of the religious discrimination cases really relate to situations where employers have not been embracing of an employee's faith or allowing them to express their religious beliefs. So in talking to Joe and Diane further and realizing that the whole intent of this program was to do just the opposite, which is to embrace all faiths, help educate our stakeholders and our residents about different religions, and not impose any particular belief on anyone, but at the same time allowing people to express their beliefs. I realized that it was a very, very low risk for us, and I understand the importance of it to our residents and to our stakeholders, and it has been a wonderful program for our company.
One of the things that we do in the Department of Spirituality is that we have chaplains for all our buildings, which is definitely unique in, oddly enough, the senior care setting or the long-term care setting, but definitely unique to corporate America.
We're all here about the resident and our staff. So what we're looking at is by bringing in the spirituality department, there's a lot of benefits I could see financially for the organization. Number one, it helps reduce your turnover. That's a real cost to the organization. We have prevented actual suicide attempts. Well, how do you put a cost to a life? I mean, you can't. So those are all the right things to do, and that's why we're doing them.
We know that a therapy CPT billing code is $26.12. A piece of adaptive equipment costs us $35.16. but the chaplain is priceless.
The idea of a social revolution, not a corporation, a movement, we believe the spiritual pillar is what helped fuel this revolution every day. God wants us all to be spiritual. We know that, our capacity. And there's so many ways we can serve each other with compassion, empathy, and love. And we think this pillar best defines it today. And today in corporate America, we need more compassion, empathy, and love. It's the one thing missing, and we're trying to put that in our company.
First person I met when I came to Signature Healthcare the day my brother was transferred was Chaplain Tim Hill when I came in the door.
I remember the first day that George came to us. He would not even look at me. When I said, "Hey, Mr. Keegans, how are you doing?"
Well, George, when he arrived at our facility, he was severely stricken by a severe case of psoriasis that covered his entire body. His face, was covered with flaky, dried skin. His hair and scalp, the same.
There probably wasn't a square inch on his epidermis that wasn't affected with psoriasis.
After he arrived at our facility, we knew that we had to do something. Every morning in our morning meeting, we bring up issues. We bring up clinical issues about residents and other things. And at the end of our morning meeting, our chaplain closes our morning meeting with prayer. And during this prayer on this particular morning, George's name was lifted, and he lifted him up amongst the group. And when we, exited that room, it was like we had a sense of confidence, a sense of assurance that we knew that the doors were going to be opened.
He just gradually got better and better, and so he could do more and more on his own.
I just started feeling better and didn't itch. It used to drive me crazy. Oh, I can raise my left arm up and put my left leg on the lift, which I couldn't do before. Oh, I have a high energy level and like I'm hyper. And I get up in the morning feeling really good.
Then it's like we started seeing that person that was trapped behind this, the medication and behind the psoriasis.
Without the partnership between clinical and spiritual in our facilities, just that teamwork together, we would never be able to achieve that true physical health, that true spiritual health with our residents.
He smiles more. He's getting his old sense of humor back. So look out. He's like the bright spot at Signature now.
You can see now that spirituality, the width and depth and breadth, it covers all segments of our business. Clinical outcomes, stakeholder engagement, therapy output, the wellness and rehabilitation of our people. The history of spirituality and long-term care has been more of a siloed approach, where it's based on prayer and part-time or volunteer chaplains or a spiritual army coming in and praying and leaving. And what we've done as a team is embrace spirituality not just as a prayer or a service of prayer, but an intervention, a true intervention of hope and healing. And you've embraced it as a partnership. And we are working together, and we are seeing the outcomes, not just clinically and for our people and for the healing of our people, but also for our stakeholders who are always suffering and have so many challenges. And the way I see spirituality plugging back in and helping you is I guess twofold. It's in the discernment process and in the decision-making process, but it's larger than that. It's purpose-driven. And I would even take it one more level up. It helps with the fearlessness, I think, that is needed for us going forward in this environment of healthcare with so many unknowns. I think about the personal and professional fear that Joshua must have had after Moses' death, and Joshua is tasked to take the Israelites into the new land, the new territory. And as they're crossing the River Jordan, be strong and courageous, because you will lead these people to inherit the land I swore to their forefathers to give them. Be strong and very courageous. Be careful to obey all the law my servant Moses gave you. Do not turn from it to the right or to the left, that you may be successful wherever you go. Then you will be prosperous and successful. Have I not commanded you? Be strong and courageous. Do not be terrified. Do not be discouraged, for the Lord your God will be with you wherever you go. And as we cross over into the new territory, have incredible revolutionary success. We love you and God bless you.
I get so lost sometimes. Days pass and this emptiness fills my heart. When I want to run away, I drive off in my car. But whichever come back to the place where you are. All my instincts, they return, and the grand facade so soon burn. Without a noise, without my pride, I reach out from the so sweet, your eyes, I am complete, your eyes, I see the doorway, your eyes, to 1,000 churches, your eyes, the resolution, your eyes, of all the fruitless searching, your eyes, oh, I wanna see the light through your eyes, a love so sweet, your eyes, I am complete, your eyes, I see the door